Okay guys, we are gonna walk through a central line dressing change. So over here we have our arm, which is tattoo practice skin that I bought on Amazon, but it works great for this class. You need a central line kit, and it says central line dressing change bro on it. Right next to it in the storeroom is going to be your port dressing change kit. Pick lines and central lines use the exact same one, so there's no difference. You will need your cap, and you'll need a cap for each port you have, and then you need a flush for each of those ports as well. And then I also have my dual caps on here. And then here is what I grabbed from the storeroom and hopefully have hanging off my name badge. So I am the nurse. I'm going into the room. I'm going to gel in, of course, and I'm going to put my gloves on. And I'm instructing the patient that I am going to change their dressing. And before I start, I let them know that, while I'm changing the dressing, I am going to put a mask on you. I want you to turn your face away from wherever the line is. If it happens to be like subclavian or jugular, if it's in the femoral, it's not really going to make a difference. So after you've educated your patient, I usually grab my central line kit. I still have my just clean gloves on. I'm going to go ahead and open up my kit and get it ready to go. Before I tear down the dressing. So you might be using a bedside table, you might be sitting it on the patient's chest, wherever you gotta put it, just make sure it's nearby and that you have it ready. So I'm gonna open this in a sterile fashion, like so. And some of you may be new to this. You always open away from you first. I'm gonna open up this. And I'm gonna put my arm here just so we can see it, but it wouldn't be in your sterile field. You're gonna come to this blue package. Still with your clean gloves, you're gonna take this out, and you are gonna set it in a different spot than where I'm gonna show you, but just for room's sake, I'm going to open it here, and then I'll move it. But you would open this away from your sterile field. So inside here, if you can see it, are two masks. One is for you, and one is for the patient. So I'm gonna take this mask. Sir, I'm gonna put this mask on you while I do the line dressing change, and then when we're done, I'll take this mask off. And then I am going to put a mask on as well. So I'm putting this mask on my face. And then I'm going to set my sterile gloves off to the side at a place where I can easily get them. And I'm gonna partially open it just so it's ready to go. Okay, so this is theoretically set off to the side on the other end of your bedside table. So now that my kit is all ready, and in real life you wouldn't do this, but I want to explain to you what's inside the kit. Inside your kit you have a chlorhexidine swab, you have a stat lock, you have alcohol, you have a measuring tape. Save this and don't throw it away. You have your CHG dressing, and you have a gauze pad for who knows. You never know what you might need that for. Put all this back in here and fold it back up, and we'll get started with our dressing change. Okay, so with my clean gloves, not sterile gloves, I'm going to take down this dressing. The place I am going to start is this individual piece of tape here that's up by the port. If you don't take this off first, it gets kind of difficult. So hit this first, pull it off your other tegaderm, and this should be kind of going up and under the port like so. And that's to help make it occlusive right there where the line's coming out of the dressing. Discard that. And then I can start working on this dressing, and I go in a circular fashion around like this. I want to do that gel last because that part is the tricky part. This is also uncomfortable for the patient. So I warn them, tape is worse than anything else. So I'm I'm going around it, I'm getting it unstuck from the stat lock, and I'm getting down to this gel. So, see how the line's coming in this way? If I go ripping this off like a mad woman and just go whoosh, I could potentially pull the line out because that gel is stuck to the line. So I want to work against the grain when I get to the point where I'm finally removing it. So here we go. I'm not touching that insertion site, but I got the dressing off. At this point, I would also loosen the stat lock. And as long as things are positioned okay, unfortunately, you know, your fingers are going to be in here by your insertion site sometimes. There's not much you can do about that. I'm going to lift this off the pegs. See how in the stat lock it's up in a couple pegs there that's securing it. I'm going to lift this out so it's free and clear. And then you can get rid of your stat lock. If it's going to make your line unstable just because of, you know, where it's hanging on the patient, and it doesn't stick this hard on real skin, but if you need to stabilize the line while you're doing the dressing change, you can always put a piece of tape up here somewhere just to keep it from falling out. Okay, so I got my dressing off, it's discarded. I am now going to take off my regular gloves. This would have already been open if I had more room. I'm going to gel my hands again, let it completely dry. And now I'm going to put on my sterile gloves. Again, for space sake, I'm going to do it right here. This isn't how you would do it in real life. You would be away from your sterile field and your undressed line. But you open your sterile gloves like so. I'm gonna grab it down here by the cuff, don my glove, grab the cuff down here, and then I'm going to grab my other glove sterilely and do the same thing, being careful not to compromise my gloves. Pick up your paper by the middle and discard it. So now I can touch inside my kit because I'm sterile. I'm going to open up my stat lock, have that ready, dump out the contents. Inside your stat lock package is this weird little foam strip. Bam. The purpose of this strip is to be able to use it to hold your line in place while you're doing the dressing change. Like I just talked about, if it's in your patient's arm and it's in a weird spot, you can take this little foam piece and maybe do a little butterfly thing here and hold it in place while you're doing your dressing change. So now I am going to open my chlorhexidine. You're going to pop it right here, squeeze those wings, give it a couple pumps, get that chlorhexidine down at the end of your sponge, and you're going to start cleaning your line. When I talked about doing hashtag style, remember in nursing school they taught us to clean here first and then to go around and keep extending your circle. Now they want us to do it like so. So I'm going to aggressively scrub my insertion site first. And I'm not going to go back there because that's clean now. So I'm going to scrub like this, and then I'm going to hashtag scrub like this, and scrub like this. Sometimes there's ooey gooeys up around your line. You got to scrub the line itself. Try to get under there as much as you can. But again, I am not going back to that insertion site. And I don't know if you can see the wetness on here, but by doing hashtag style, I ended up cleaning a broader space than I would have doing a circle. So now I can discard this. I'm done with it. This would dry faster in real life, but for simulation's sake, I'm going to wipe it off with a gauze. But don't ever do this on a real patient because you want to let it air dry. That's the whole point. Just doesn't like to do it on this vinyl skin. Okay, so we air dried, we didn't use the gauze. Before I get a dressing on there, I'm going to put on my stat lock. You'll notice on your stat lock there's like a little notch here, and there's arrows. Those arrows should be pointing at the insertion site. and that notch is in place to give it room to go under the line. So the arrows are pointing downward toward the insertion site. So I'm going to get it up under my line, like so, and I'm going to sink it down into the peg. And sometimes this is a little tricky, but I got it down in my pegs, trying not to touch my insertion site. And then you flip these wings over, snap them in. You do not want to secure this to the skin until you have those wings set down into the pegs, because, you know, it would affect sometimes, you know, the placement and not be sitting quite right. So make sure you get them down in the pegs before you actually secure it. Use a skin protectant pad next. You're going to wipe that all around under where this is going to be touching the skin. Once that's dry, you're going to pull these little adhesive wings out here, secure it, and I'm going to do the other side. Grab this and pull it out, and secure it. Now your stat lock's in place. I can really yank on this. It's not going anywhere. So it's a lot more secure than your sutures. I don't need this little foam piece anymore that I was using. If I feel like keeping it because it's in a good spot, by all means, it's not going to hurt anything, but I usually get rid of it. So at this point, I'm going to take my Tegaderm dressing. You'll notice a few things on here. There's a V-notch here. There's a V-notch here. You can put this dressing either way, long ways, short ways, doesn't matter. But try to get that notch over this line hub here, like kind of where the clamp is. It's to help position it and cover as much of the line that's coming out from under the dressing as possible. However you put it, whatever makes sense is fine. The only thing I would say is I want that gel patch to be dead centered over the insertion site. Some of that gel may or may not come up over the stat lock. It's fine, but you want the middle of your insertion site to be dead center under that chlorhexidine. So I am going to kind of position it like so, because I got my V-notch there. I'm going to kind of strategically go around here and secure it so it ends up being as occlusive as possible. See how I got it around there and I got it stuck up under that V-notch. The gel patch is centered over the insertion site. Some of it did go over the stat lock, which is fine. Once I'm at this point, I'm going to go around and remove the border. Save this piece with this weird piece of tape. You're going to use it. Sometimes it's hard to grab. Finish removing my border. And save this as well. This has your label. So now I'm going to take this weird extra piece and I'm going to use it to secure this spot. So it's going to kind of come up and under the line. So I go kind of like this. I'm going to secure it out here. I always grab my line and kind of do a bait and switch there. So see how it's under on this side. It's got the original Tegaderm coming up here, so we have it completely occlusive. There's no open spots there. It's completely sealed in there. That's what that's for. And then I am going to take my label here. I'm going to date it, time, and initial. You really almost have to use a Sharpie on these, just a heads up. A regular pen doesn't work very well. And I can put this anywhere I want. Some people like it here. I'm a sideways kind of gal, but just put it somewhere where people can see. And now you are done. So you can document your dressing change in the avatar. Before we leave the room though, I'm going to take off my gloves. I'm going to gel my hands again, put on clean gloves, and then we are going to change the cap. So I was talking to you about that double scrubbing, and here's what I mean. I'm gonna get rid of my cap here. This is my alcohol cap. I'm gonna take my fresh alcohol swab. I'm gonna scrub the crap out of this old cap that we're gonna change. And it's kind of juicy, so I'm gonna kind of squeeze it, let it get in under here, seep in under there, scrub all of it. I'm gonna let that dry. While that's drying, I'm gonna take my new cap and a 10 cc flush, get it ready to go. I'm gonna open up my package here. I'm gonna keep the package kind of sterile and not touch the inside of that because I want to use it. And I'm gonna attach my flush to my cap. I'm gonna take this blue end off. I can either save it or I can leave it off and set it sterilely in the package. I like to do it this way, prime it, and I set it right there in my package that's still sterile. Now I'm going to remove this cap, discard. I'm gonna take a fresh alcohol swab, a brand new one, so you need 2 of them for this process. And I'm gonna scrub the dickens out of this again. I'm gonna get down the outside of this hub. This line is open now. This is your most risky point. I'm gonna let some of the alcohol kind of seep down in there a little bit to get the inside. I'm gonna let this completely dry. Then I'm going to take this brand new primed cap, screw it on there, flush my line. I get good blood return. I'm not going to use the full 10 cc's for the demonstration because it's going on my desk, but you would use the full 10 cc's, you would use that push pause technique. Then I would take a new dual cap that I have here. This is what the inside of it looks like. And I'm going to place it on my line. And I am now done with my dressing change. I'm going to document all of that in my flow sheet. So that is how you do a dressing change, and I wish you luck. And the girls will help you with it.